Hi, my name's Emma Bray and I'm an outreach worker for Friends, Families and Travellers.
Hi, my name's Josie Garrett. I am a policy coordinator at Friends, Families and Travellers. We are a national organisation working on behalf of Gypsy, Roma and Traveller communities. Everyone in society should have fair access to a COVID-19 vaccination when they're entitled to one, and everyone should have the opportunity to remain up to date and informed on relevant information about the vaccine. We know that for some groups who are facing long-standing inequalities in healthcare access and outcomes, there will be barriers that may impact uptake to the vaccine and that people may not be receiving key relevant health messages. Evidence from studies on uptake to immunisations broadly suggests that for Gypsy and Traveller communities, access rather than vaccine hesitancy or refusal is the most significant barrier to vaccine uptake. There are a few practical adjustments primary care services can make that can support access for Gypsy and Traveller communities, and there are a number of things that health professionals can be aware of to help to ensure that people from Gypsy and Traveller communities can make an informed choice around vaccination. In this video, we'll cover some of the key issues for access to vaccination for Gypsy and Traveller communities and some simple, practical recommendations that can help to support access to vaccination. This includes ensuring that no one is wrongfully refused registration in primary care, linking in with trusted local charities and networks to support culturally competent community engagement, and ensuring that your communication approach is accessible and inclusive. There are estimated to be around 300,000 Gypsy and Traveller people in the UK, which is around 1 in every 200 people. Within Gypsy and Traveller communities, around 3/4 of people live in bricks and mortar housing, whilst around 10,000 people live roadside on unauthorised encampments, and around 70,000 people live on Gypsy or Traveller sites.
As an outreach worker, I know that there is a huge number of communities that fit under the umbrella term Gypsies and Travellers. This can include Romani, Irish, Welsh, Scottish and English Gypsies or Travellers. It can also include new travellers and boaters. Each of these communities have their own distinct history and many of them have their own language and culture. Romani Gypsies and Irish Travellers have been recognised under English law as ethnic minority groups, but this will also include Welsh Gypsy Travellers and Scottish Gypsy Travellers. And of course, not all Gypsies and Travellers share the same views on everything or have the same experiences, so it's important to not treat them as if they're one group and respect people's individuality.
Gypsy and Traveller communities are known to face some of the most severe health inequalities and poorest life outcomes amongst the UK population, with higher rates of long-term illness, higher overall prevalence of reported chest pain and cardiovascular conditions, and higher levels of respiratory problems. This means that within Gypsy and Traveller communities, there is a disproportionately high number of people at increased risk of severe illness from coronavirus. A recent study from the University of Manchester shows that the average health of a 60-year-old in a Gypsy or Irish Traveller community in England is similar to the average health of an 80-year-old from the white British population. Disaggregated data on the health of Gypsies and Travellers tends not to be routinely monitored within NHS services, and your service may therefore not be aware of Gypsy and Traveller communities in your local population, their needs, or the inequalities they face. However, this doesn't mean that these inequalities are not important or that there's not much that you can do. If you'd like to access data to help you understand the population size of Gypsy and Traveller people in your area, please view page 35 of our guide on tackling health inequalities in Gypsy, Roma and Traveller communities.
One of the key things that primary healthcare services can do to support access to vaccination is to make sure that no one is wrongly refused registration at a GP because of issues like no ID or no fixed abode.
In England, there's no regulatory requirement to provide these details in order to register, but there is a gap between policy and practice, and many nomadic Gypsies and Travellers are wrongfully refused registration on this basis. In 2018, we mystery shopped 50 GP practices in England and found that nearly half of the practices we contacted refused registration on this basis. This has significant impacts on access to healthcare and invitations to preventative health interventions, such as immunisations and screening, which are based on GP records. If people are not able to register with a GP, they will not be invited to vaccination when they should be. It's really important that all members of staff within GP practices, including practice managers and reception staff, are aware of and up to date around patient rights around registration and are fully informed of their responsibilities to register people with no fixed address and no identification. No one should be turned away from primary care services on this basis. We have also heard of many reports during the pandemic where practices are only allowing new registrations through online forms. The NHS England guidance and standard operating procedures for general practice in the context of coronavirus is clear that practices should continue to register new patients where capacity allows, prioritising those with no fixed address, asylum seekers, refugees and people leaving custody. Practices may only refuse registration if they have reasonable grounds to refuse services to patients. Delivery of applications for patient registration may be by any means, including post and digital, for example, a scanned copy. Where a practice has online registration options, a supported signed letter from the patient posted or emailed to the practice is acceptable to complete the registration. When processing registrations for patients from Gypsy and Traveller and Bota communities, it's also important not to assume that a patient always wishes to be registered as a temporary patient. This can restrict access for patients to non-urgent care, invites to routine screenings, or referrals to specialist care, which has important implications for health. Since 2015, all GP practices in England have been free to register patients outside of practice boundaries in order to support patient choice. For nomadic patients, travel outside of a practice boundary is often important for work and for social reasons. When it comes to temporary or permanent registration, patient choice is key. Ensure that you communicate with patients around the implications of permanent or temporary registration and offer the option that the patient wants and needs. This will help to ensure that your practice is inclusive and is supporting access to vaccination at this critical moment in the pandemic. Across the whole of the UK population, there have been high levels of fake news and misleading information shared around the vaccine, which can contribute to concerns around vaccination. We're aware of specific concerns within Gypsy and Traveller communities that Gypsy and Traveller people may be targeted with the vaccination with negative intentions, including concerns that Gypsies and Travellers will be targeted in order to test the safety of the vaccine. A poll commissioned in December by the Royal Society for Public Health showed that only 57% of respondents from Black, Asian and minority ethnic backgrounds were likely to accept a COVID-19 vaccine, and that's compared to 79% of white respondents. While no official polling results have been launched for Gypsy and Traveller communities, we expect the results to be similar to people from other minority ethnic backgrounds or perhaps lower. This reflects a lower level of trust in government within Gypsy and Traveller communities due to historic and present-day experiences of direct or indirect discrimination from public services. With this in mind, you may find people from Gypsy and Traveller communities in your local population have lower levels of trust in the COVID-19 vaccine. It's really important that healthcare services consider how they can ensure everyone has all of the information they need to make an informed decision about taking the vaccine, and that healthcare professionals are equipped to address misinformation around the vaccine. Linking in with local trusted organisations and networks can support this, and trusted local services and organisations will be best placed to determine the best approaches to disseminate information on the vaccination locally. We are aware of proposals in some areas to carry out assertive outreach onto traveller sites with the vaccine. Broadly, in our organisation's work over the past 20 years, we've heard that most Gypsy and Traveller people want to access healthcare through the same means as other people in the population, and therefore we would emphasise the importance of fair access to services. Unless you have local evidence and long-standing trusting and positive relationships with people living on traveller sites in your area, we would not encourage you to visit traveller sites to assertively outreach with the vaccine. There's a very real risk that this will either scare people or stigmatise people within their local communities. If you speak with community members and trusted networks locally and they think that outreach to sites is a good idea, then you can refer to wider government guidance to support your approach. You can refer to our service directory at Friends, Families and Travellers for more information on local trusted organisations and services and how to get in touch, or email us for advice. To ensure that health messages and information reach everyone, it's really important that these are delivered in accessible formats. Around 40% of our service users at Friends, Families and Travellers have low or no literacy. However, this isn't an issue specific to Gypsy and Traveller people, and in fact, around 16% of the whole population have low or no literacy. Without support, many patients will therefore find it difficult to read medical letters, access services, and to access key information. In addition to this, people from Gypsy and Traveller communities are more likely to be digitally excluded. We previously interviewed 50 Gypsy and Traveller people and found that 1 in 5 participants had never used the internet, compared to 1 in 10 people from the general population, and only 38% of Gypsies and Travellers, or 33% if housed, had a household internet connection, which is compared to 86% of the general population. At doctors' surgeries, vaccination hubs and other services, routinely offering discreet support with form filling can support those who may otherwise be unable to access services or who may be deterred from accessing a service if information isn't provided in an accessible format. It can feel difficult or stigmatising to ask questions around this, so instead of saying, "Can you read or write?" you can ask, "Can I help you with this form or letter?" You can also use voice notes instead of text messages to communicate with patients with low or no literacy. In addition, to support access to services, it's important to ensure that no processes become digital by default. Digital processes can unwittingly exclude people facing digital exclusion as a result of literacy levels, levels of English language skills, or financial difficulty accessing data and devices. Ensure that you offer different ways of accessing support, and flexibility is key. In general, when providing information around the vaccination and other important health messages, consider how you can make your communications more accessible. Offer videos and audio recordings of information wherever possible, offer telephone communication as opposed to written correspondence, and consider the use of audio tools such as Browse Aloud, which adds speech, reading and translation to websites. For people who are on the move, it's really important that communication preferences and contact details are kept up to date so that patients are able to receive invitations to vaccination. Many nomadic patients may be registered at a care of address or with an address where they no longer live, so be flexible with your invitation approach rather than using a one-size-fits-all approach and sending letters to people who might not have fixed addresses. Contact people by text or telephone and ask patients about the best ways to keep in touch. This will help to ensure that you're reaching people with important invitations and information about their health. Finally, for those living nomadically, consideration should be given to how best to administer the second round of the vaccine. There are both push and pull factors for travelling nomadically. In terms of push factors, evictions of roadside camps have continued throughout the pandemic and are likely to increase as lockdown measures lift. Failure to comply with evictions can result in being imprisoned, fined, or having your home removed. Similarly, many people living on boats are subject to strict continuous cruising rules, requiring them to move from place to place every 14 days in a continuous direction along the canal. If boaters fail to meet the requirements, they can have their boat licence removed and potentially have their home seized. In terms of pull factors, people living nomadically often travel for work. There are very practical implications for this in regards to people waiting for either their first or second round of the COVID-19 vaccine. It's really important to have open discussions with your patients about where they are likely to be when the second round of the vaccine should be administered. If a patient does want to keep travelling, you can contact a GP in the new area to support the patient and make sure that they get access to the second dose. If your patient wants to access the second dose in the same area but is worried that they might be evicted or subjected to continuous cruising rules within this time, it may be really helpful for you to write a short letter highlighting the importance of the person being able to stay in the area for this period of time. Many waterways organisations have suspended continuous cruising rules during key periods of the pandemic, whilst many local authorities have implemented negotiated stopping during the pandemic. We have provided a short draft version of this letter that GPs can use to support people to stay in one area to receive both doses of the vaccine. Within this video, we've covered some simple practical recommendations that can help to ensure fair access to vaccination for Gypsy and Traveller communities. This includes inclusive GP registration, linking in with trusted organisations and networks to reach out to your local population, and ensuring that your communication processes are inclusive and accessible. For more information, you can contact us on fft@gypsy-traveller.org or via our helpline on 01273 234 777. Thank you.